you've suffered a stroke and you're looking for some gentle movements to do while in a seated position, then you're in the right place. Welcome to active sitting.
Hey, what's going on? I said active sitting, not active shrinking.
Hi everyone and welcome to Exercise for Health. I'm Richard and today we're going to be looking at some mobility movements for stroke survivors to help with circulation and break up long periods of sitting. So these exercises can be done on a daily basis, but if you feel that you've been sat down for more than 1 to 2 hours, then you can do it twice a day, 3 times a day if you wish. So stroke survivors, as you're probably aware, are left with a variety of impairments. Some can be physical, some can be cognitive. And it's really important to understand that the 8 exercises that I'm going to go through with you today, you don't feel that you have to perform all 8. Just do the ones that you feel that you're comfortable with and the ones that you might prefer to be able to do. But I will try and show you some adaptations for each of the exercises as we go through. So to start off with, the first thing we need to do is from your seated position, you should be in quite a relaxed manner, but we need to get yourself to an active sitting position. So to do that, we're going to walk our hips forwards to the front half of your chair. Now you might feel that you want to be able to use your arms, certainly if you're in an armchair like I am, I can use my arms to pull myself to an upright position before I start to walk my hips forwards. If your stroke's affected you on one side and you don't have the use of one arm, then you can use the other arm to assist you, just to walk your hips forwards until you're sat a little bit further forwards in the chair, so you're not sat right in the back of the chair. So once you've got yourself to this position, make sure you've got your feet about a shoulder width wide on the floor, and the main focus is for you to try and sit yourself up tall. So imagine if you're trying to take the bottom of your ribs up and away from the top of your pelvic bone to try and sit yourself up tall, get that nice postural position. So hopefully you'll feel that the muscles around this core area are feeling engaged, you're feeling like they're already activating. So that's the first thing. So this is going to be our seated position that we're going to stay in to be able to do the 8 different exercises. But if you feel at any point you're starting to get a little bit tired, then you could quite easily just walk your hips back and then just get yourself back to a more comfortable position and then relax. Okay, so if at any point throughout this video that you feel it's getting a little bit too much, just walk yourself back and get yourself back into a relaxed position. Right, so let's start off then from this active sitting position. So you're sat up nice and tall. What we're going to do is we're going to work through different joints in the body and work our way from the top down and just get some movement within those joints just to get the circulation going a little bit. So the first thing I want you to do from your seated upright position is we're going to do some head turns. So the movement from there is I'm going to keep the rest of the body still, but I'm going to turn the head as far as I feel comfortable going one way and then bring it back through the center and then turn the head the other way again as far as you feel comfortable. Now for each of the exercises we're going to do today, we're just going to do 3 on each one. In this case, because we're going to go each way, we'll do 3 head turns each side. They must be performed slowly, so don't try and do it too vigorously and don't try and force the head to go around too far. So I'm going to do 1 more on this side, so I've done 3 each side. And then come back to facing the front. Okay, so still make sure you're sat in this upright position, and then we're going to go on to the next one. So the next one is we're going to go to the shoulders now, so we're going from the neck to the shoulders. So this next one is a shoulder shrug, which is basically lifting the shoulders up towards the ears, and then allow the shoulders then to drop back down. So imagine like if someone asked you a question, you didn't know what it was, and you did that, that's basically a shoulder shrug. So again, make sure you're sat up tall. Okay, make sure you've got a good solid base still with the feet to help you sit up tall. And then from now I want you to think about lifting both shoulders up towards the ears, as high as you comfortably can, and then just relax and allow the shoulders to drop back down. Now it may be that if your stroke's affected you on one side, you may feel that you need to support that arm to allow it to lift up, so it comes up with you. And it also might be that as you're doing the shoulder shrug, that again, if your stroke's affected you on one side, that one shoulder pops up and the stroke affected side doesn't move quite so much. So if you can, really focus on the stroke affected side to try and make sure that one's coming up just as much as the stronger side. So again, we're going to do 3. So nice, slow and steady. Keep breathing with the movement. Make sure you're still sat up tall and you've not slouched yet. That's 2. I'm going to do 1 more. And that's 3. Good, so that's our second one done. Right, we're going to go on to the third one now, and the third one is we're going to move from the shoulder down to the elbow joint. So I'll show you the exercise, and again there'll be some adaptations for this one for some people that have had a stroke. So what I want you to do is you're going to rest the back of your arms onto your knees and try and get your elbows to go out straight with your hands open. This is going to be the movement. I'm going to make fists with my hands first, and then I'm going to start to bend the elbows. So I'm going to bring the fists up towards the shoulders, and then I'm going to allow the arms to drop back down to the knees, straighten the elbows out and see if I can open up the hands again. So that's going to be the movement. Now again, like we did with the shoulder shrug, if you find that your stroke's affected you on one side, what I want you to do is, if this was my weaker side, I'm going to use my strong arm to take hold of that wrist, and then I'm just going to gently allow the arm to drop, see if I can get that elbow to go out straight, and then gently then lift it back up to its start position. Now it may be that you don't have as much movement as this. It might be that you just straighten the arm a little bit and then bring it back to the start. That's absolutely fine. You're going to go to your level, whatever ability you have on the arms, just do whatever you can, whatever you're comfortable with. Again, don't try and force it. So it should just be really slow and steady. And again, we're going to go for 3. So that's the alternative if your stroke's affected you on one side. I'm going to show you from this one. Ready? So we're going to do 3 of these. So clench the fists, bending the elbows, fists up to shoulders, and then let the elbows straighten back out, and see if you can then open up the hands. So we're working through the hands, the wrists a little bit as we open up the hands, and then obviously the elbow joint is the main focus here. And we're going to do 3, so we'll do 1 more. Brilliant. Good. Okay, so we've done 3 now. So if you're starting to feel a little bit tired, remember you can always work yourself back into your chair and relax for a little bit. But if you're happy to carry on, make sure you still engage in these muscles to sit yourself up tall still. We're now going to go on to a twisting movement. So for this one, you might want to hold your arms this way. Again, if the stroke's affected you on one side, you might want to hold on to that elbow joint. So I've got my hand under that elbow, but just folding your arms over like so. We're going to twist the spine this time. So the movement is to turn the shoulders, to turn them face one way. Then you'll come back to the center, and then you'll twist the shoulders to turn and face the other way. And then back to the center. Now as I'm doing this, I'm making sure that my head is actually turning with the shoulders. So I'm not leaving my head facing forwards as my shoulders turn, and also I'm not turning my head round even further. I'm just making sure that wherever my shoulders are, that's where my head's going with it. So I've got the support of the arms as well. There's not much movement to this as you go from left to right. Again, still make sure you're sat up tall while you're doing this one. It's quite easy to slouch as we're twisting the spine. Do 1 more on this side, and then come back to the center. Good. Okay, so that's the torso twist. So again, that's working through the spine. We're going to do another one to work through the spine, which is going to be a side bend. Now for this one, you might want to allow your hands to just relax on the side of your chair, just to give you a little bit of support, because basically we're going to be bending the spine from side to side. So you might find that holding onto the chair, even if it's just with one arm, so even if I've just got one there, I can just hold onto that for a little bit of support. But still sit yourself up tall, and then I just want you to then lean the body to one side just slightly, and you might feel a bit of a stretch on the opposite side. Come back up to the start position, and then lean the body, same the opposite side. So rather than twisting the spine this time, we're flexing the spine from side to side. And again, we'll just do 3 on each side. So that's 2 on each side. We'll just do 1 more. Come one way, back up to the center, and then doing the last one. And back up to the center. Good. Okay. Right, so that was a couple that we've just done for the spine. We're now going to move further down. We're going to go to the hips. Now for this one, you probably won't see much movement with this, but the main emphasis is you're going to try and push the heels of your feet down into the floor, and what that'll do is it'll feel like it's clenching your buttocks together, and you might feel like your body just pops up a little bit out of your chair as the buttocks clench together. So all we're trying to do is we're just trying to activate these muscles around your bottom that go around to support the hip, and obviously these are crucial that they're used when we get you from a seated to a standing position. So in the next video that I'll do, we'll look at doing some standing exercises. So if you're confident enough, then you could get yourself to a standing position, then these muscles will be used to get you into a standing position from your chair. So again, make sure you've still got your feet in the same position, make sure you're sat up tall, hands can go wherever you want for this one, and then from there you're thinking about pushing through the heels of the feet to just push into the floor, which will clench the bum cheeks together. It might raise you up a little bit out of the chair and then relax again. So do the same again. I'm going to push my heels down into the floor. I'll feel a little bit of a tightness then underneath where I'm sat on my seated bones effectively. I can feel the muscles just clenching around there and then relax. So we've done 3 of those. That's it. We're only going to do 3 on each. So we're now going to move on to another one. So we've gone from the hips. Now we're going to go down to the knees. So for this one, all I want you to do is I want you to straighten out a leg as far as you comfortably can, and then you're going to slide the foot back to your start position until it's bent. So we're basically straightening one knee, and then we're going to bring it back to your start position. Now, if your stroke's affected you on one side, you may find it okay to try and move the foot forwards, but bringing the foot back you might find more difficult to try and get the knee to bend. So use whatever strategies you would normally use to move the foot around, so whether it be grab and hold and lifting the knee up to allow this foot to come back in, feel free to do that, because remember we're looking at movement, we're not really looking at trying to force the leg out and back again. So as long as you can get some movement in the knee, then that's brilliant. So if you feel that you need to move the one leg, that's fine. We're going to alternate left and right, and we're going to do 3 on each side. So let's start off with the first one. I'm going to slide this foot out along the floor so the knee's beginning to go straight, and then I'm going to slide the foot back, bringing that heel in as close as I can towards the chair until the knee's bent, and then I'll try and then do the same on the other side. So I'm going to straighten the knee out as much as I feel comfortably can, and then draw that heel back till the knee's bent. So we're going to do 3 of these on each side. Again, still make sure you're sat up tall. I've just done that and slouched a little bit, so I'm going to sit myself up tall while I'm doing the movement. 1 more on each side now. Don't worry if you can't get the knee to go completely straight, doesn't matter too much. Fantastic. Brilliant. So there's your knee mobility one. We've got 1 more to go. Okay, so now the last one we're going to do is one for the ankles. So for this one we're going to be able to flex at the ankle and then let the heels drop back down. So what we're aiming to do is we're aiming to lift the heels of the feet off the floor by pushing the balls of the feet down into the floor, and then let the heels drop back down again. Now it might be again that if you've got your stroke's affected you on one side, you might have an AFO, you might have a splint on there, you might be using an FES with the box. Ideally you want that turned off if you've got a box, but the movement is to try and really focus on trying to get the heels to lift up off the floor, and you'll feel the muscles in the lower part of the back of the leg work a little bit. If you find that where your stroke's affected you, you can't really get much movement in the ankle, because there tends to be, with the stroke patients that I've seen in the years that I've been doing this, the foot tends to drop down quite a lot. So it might be difficult to actually try and get the heel to drop back down and force the heel back down on the floor. So it might be easier on your stroke affected side to try and bring the heel of the foot back and the lower part of the leg back as close as you can to the chair, and then just move it forwards a little bit. And by doing that, you'll then gauge a little bit of movement into the ankle as you're bringing it right back. So that's where it's going to flex here in the ankle, and then just move it forwards just a short step, again just to allow the foot to point away a little bit. So that's an alternative if the stroke's affected you on one side and particularly you're restricted around the ankle joint. But if you can, we're going to focus on trying to lift both heels up at the same time, and then drop back down. So allow the heels to drop back to the floor. So I'm pushing through the toes. You notice my knees are popping up as my heels are coming up, and then drop back down. Do one more. Heels up, and then drop back down. Good, okay. So there's all your mobility exercises. There's 8 exercises we've done there. Each one of those we've done 3 times. And remember, the important bit is that between the exercises, if at any point you feel that you need to relax, all you do is you walk your hips back into your chair and you just allow yourself to have that relaxed time, which is really important. So don't feel that you have to do all 8 in one go. You can take your time to go through it. And again, you might find that you can't do all of those, so you can just pick and choose the ones that suit you. But hopefully that'll help just get a little bit of circulation going, and it'll help with the mobility of some of those joints that we've gone through from top to bottom. So I hope you've enjoyed that today. Hope you can take something away from that, and hopefully that will just take away some of the long periods of sitting that you might have when you're at home. And then hopefully then I'll see you on the next video, and we'll look at doing a similar sort of thing, but in a standing position. So I'll see you on the next one. Okay, well done. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel, or click here to watch a recent video. See you soon.